This is Dr. Christopher Sundy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to go over briefly a question that I get asked frequently, which is, why do I need ketamine therapy? And we know that ketamine acts as a rapid-acting antidepressant and that it works effectively in over 70% of treatment-resistant patients who have failed multiple other methods of treatment, such as shock therapy, ECT, transcranial magnet stimulation, and multiple rounds of regular traditional medications through the years. Now, we know that ketamine therapy works within hours to days of the start of treatment. And usually people notice the effects by the fourth infusion, which is typically around day 7 of treatment, whereas it could take weeks for any traditional therapy, such as an antidepressant, to actually show some efficacy in individuals. Now, the other neat thing about ketamine is that it can augment the effectiveness of your baseline medications and make them work faster and better. And there are studies demonstrating that ketamine mixed with Lexapro at the start of traditional treatment can actually make the Lexapro medication work faster and better in a series of randomized controlled trials. We also know that ketamine has few side effects and that it's mainly during the infusion itself that people notice any problems, which is typically nausea, occasionally vomiting, all of which we use prophylactic medications to prevent. There can also be some dizziness and occasional blood pressure changes and heart rate changes that stop after the infusion is stopped. Each of these are easily monitored and controlled, and they effectively are non-events. Now, ketamine also works through a totally different neurotransmitter system than any other antidepressant out there. It works through the glutamate system, which is the main neurotransmitter of learning and neuroplasticity in your brain. So about 60% of the neurotransmitter load is through the glutamate system, whereas all your other antidepressants are working through serotonin and dopamine maybe, and those work slowly, if at all, in a lot of people. So ketamine can be a life-changing experience. The experience itself of the infusion can be insightful and experiential. Individuals can see themselves differently and start thinking outside the box. They can reframe their memories and understand them in ways that they couldn't before. And effectively, we see that ketamine can enhance an individual's psychotherapy treatments because ketamine basically reduces cognitive rigidity, and that's basically our inability to see opportunities for new directions in our thinking process. And it does this through enhancing neuroplasticity, which is essential in brain growth and learning. And also, this allows us to think more clearly, to diminish brain fog, which is typical in depression. And neuroplasticity is basically the growth of neurons together in areas where they've come apart because of stresses and medical illness, and of course, ultimately resulting in depression. Ketamine also enhances wellness factors, such as increasing sense of hope and motivation, and improving self-esteem and decreasing fatigue. It also decreases the negative side of our thought processes that we see in depression, such as ruminations over negative things, anxiety, negative self-talk, and self-sabotaging behavior. There are no other medications out there that actually treat wellness factors or that have studies that demonstrate improvement in these areas. And ketamine does actually improve a lot of these different experiences that we have that are so negatively impacted by depression. Now, ketamine and ketamine infusions do not have typical side effects as traditional antidepressants do. So ketamine does not cause anhedonia. Anhedonia is kind of the loss of pleasure, the loss of excitement, and the joy of life. It's a situation where people are frequently feel when they're started on antidepressants, and they quit being sad or tearful, but they're not excited either. They just have emotional blunting. They just exist. And ketamine is actually a treatment for that. It actually treats anhedonia. In fact, anhedonia is something that we see in individuals who come off of things like cocaine use disorder and opiate use disorder. When they basically detox to nothing, many of them just don't feel excited. They don't feel happy. And if they're not feeling anything at all, that's the same thing as feeling depressed. There is also no weight gain associated with ketamine therapies. There are no sexual side effects, so we don't see any of those problems that we would traditionally get with SSRIs. And the additional feature of ketamine is that we use it for addiction treatment on a number of different fronts, such as alcohol use disorder, cocaine use disorder. And there's really no traditional addiction issues per se with ketamine. It can certainly be abused and misused, but there are no physiological withdrawal effects from people who have used it in super ultra high quantities for many months or years. You can stop it and there's no withdrawal from it. So again, the neat thing about ketamine is that it's monitored by a prescriptive fashion. It's not readily available either, but it is again a substance that people use because it helps them on a mental side of things, making them less depressed, and not because they are buzzed on ketamine. Because really, when the ketamine is used, it's out of your system, within the hour, but it's the effective neuroplasticity that results over the next several hours to days that really is what's doing all the healing. So you're kind of setting into a series of events of neuroplasticity that is actually causing the individual to improve. And the other thing about ketamine is that you could stop it anytime you want. There's no negative effects or withdrawal. So if you're getting ketamine treatments, you could just stop them and see how you're doing. And there's not going to be any withdrawal, unlike things like coffee, for example, where you get headaches, or marijuana or other types of substances. And the other thing is, as I mentioned earlier, ketamine is out of your system rapidly. So we know that an individual who feels better the next day or the next couple of days is doing so because there's actually changes in the way that the neural circuits are functioning and neuroplasticity is occurring. And this is not because the person is, again, being buzzed by ketamine. That ketamine is gone. It's actually, ketamine kicks into action the production of proteins involved with making our brain feel better. So we know traditional antidepressants frequently fail. And that's why you're looking at this video, because you're trying to find out how to make yourself feel better. And you're looking into ketamine because you're hearing a lot about it in the lay press and a number of other articles. And the truth is that there's a huge response rate to ketamine. And we know that traditional antidepressants, only 1/3 of patients treated will remit from depression after about 2 months of treatment, but 1/2 of them will relapse back to depression within the year. So again, this goes to show that with traditional medications, you're still effectively treating the individual. You're not curing them. And just to let you know, ketamine is a treatment, not a cure. So it does require some upkeep, but the goal is to get you in remission, because the chances of you feeling better for longer are much higher when you can do that. And ketamine works rapidly, so you know immediately whether or not ketamine is doing the job for you. And the other thing about traditional antidepressants are that it may take weeks to see the effectiveness. And then, of course, the traditional medications fail to treat many of the key symptoms of depression, such as low motivation, brain fog, and fatigue. And they also cause side effects such as weight gain and sexual side effects and emotional blunting, otherwise known as anhedonia. And you also do have to withdraw from your traditional antidepressants, such as Prozac and Effexor, which can result in things like brain zaps. And brain zaps are a very uncomfortable feeling among other types of symptoms people have. And the last thing is that antidepressants work from the lizard brain side of the systems of our neurotransmitters, the serotonin and dopamine. And it doesn't really work from a top-down controlling system, which glutamate is the top-down system. It is what runs the majority of our cerebral cortex in terms of learning. So how has your antidepressant treatment worked out so far? How many times have you failed in a particular treatment and then had to go on to the next medication and the next medication? And have you suffered long enough? We know that the mental health journey is long and it's painful, and you suffer and you lose so much opportunity in your life as a result of not being able to feel good about the next great things in life, the next great adventure, and to be able to fulfill your hopes and dreams, because you don't have any, because you're depressed and these other medications are failing. So what are the risks of ketamine? Well, you have the IV needle stick. There's your time and cost. And we know that ketamine doesn't change your personality, so it's not going to change your preferences. So if you don't like your boss, I can't make you like them. If you don't like your cat and your dog, I can't make you like them. And it won't change your family around you either. So that's up to you. The healing comes from within. And any side effects that occur with ketamine occur during the infusion. And that's basically nausea and some balance issues, brief vital sign changes, and the trippiness, which all is easily controlled and controllable with traditional medications and prophylactic medications, and they go away just shortly after you stop the infusion. And just one last thing is that this is a treatment, not a cure. So you will need follow-up infusions and home-based ketamine treatments such as nasal spray and lozenges, which can really promote the effectiveness of your infusions. And also you can use this to help promote and augment your traditional antidepressants. And of course, the fear of use and misuse of home-based ketamine can be easily monitored. You're given a certain amount, and if it's gone, then it's gone. Then that's pretty much it. So the real question for you should be, why haven't you tried ketamine therapy yet? And really, that's a question you have to ask yourself. Given all this information, you've been certainly researching, I imagine, different opportunities out there. And ketamine really has a great side effect profile. There's very few, and great efficacy in such a huge number of individuals that it only makes sense that this would certainly be a direction to go.